I'm Diane Laverty, I'm a Macmillan nurse consultant for palliative and end-of-life care.
My name is Karina Catley, I'm the Macmillan Evaluation Lead on the End-of-Life Care Programme.
This is a partnership with Macmillan. It's a 2.5-year fully funded grant which consists of a team of a nurse consultant, a paramedic lead and an evaluation lead.
The aim of the programme is to improve the knowledge, skills and confidence of ambulance clinicians and our 999 control staff, so from the very first point of the 999 call up until when we visit patients in their own homes.
The important thing really is that historically paramedics haven't been involved with end-of-life care. Their training is very much focused on life-saving skills. So we are very interested in improving their knowledge, skills and confidence in managing palliative and end-of-life care in the pre-hospital setting. Obviously, one of the things that we really want to avoid is patients near end of life going to hospital unnecessarily.
The emergency department might not always be the best place for these patients. It might be against their wishes, but also it can be quite detrimental to admit a patient to hospitals.
Sometimes that doesn't marry up with what their wishes are. They may like to stay near a home. So we've been working closely with hospices in order to create some pathways and some communication channels so that if clinicians are on scene with patients and they're experiencing complexity and they need to have some support and advice, they can phone the local hospice even if that patient isn't known to them. We're interested in thinking about coordinate my care and advanced care planning. So advanced care planning is a concept we want to embed with the London Ambulance Service. It's something that's not been part of their language in the past. So we're thinking about the conversations that patients and families have had to think about their preferences and their wishes and their decisions that they've made for their future care planning. So we use a system called Coordinate My Care, which is an electronic platform to document all of those wishes. In the emergency control rooms, we're thinking about how we can help staff manage those calls that come in from palliative and end-of-life care patients, to think about how they can best help them in a very timely manner.
What we're aiming to do in this programme is to increase ambulance clinicians' confidence. There can be some quite distressing situations, so we're aiming to support colleagues and increase their education and guidance around palliative and end-of-life care.
Since we've been in post since August 2018, we've been thinking about how we sustain the knowledge and attitudes that we have been embedded in our staff. So one of the ways that we think is a good achievement is our network of end-of-life care coordinators,
which is a group of ambulance clinicians and control staff that volunteer to be a champion for end-of-life care across the service. They provide education locally, they feed back into the Macmillan team and they spread key messages, and I think that's really key to sustaining the increasing confidence in palliative and end-of-life care.
They've also been important in looking after the well-being of their staff and linking with us, the central Macmillan team, in letting us know any areas of concern that we need to address.